The art of healing is to cure a patient, both physically and mentally. So the primary approach is not to uphold any particular school of medical science, rather, the key task is the patient's welfare. Body's healing power. The disease is caused by abnormal activity. One does not see any harm in using medicines to help nature, just as the earth, water, and air are medicines. Are not various types of medicines also prepared by selecting ingredients from nature? Of course, one must take medications to help the body's healing power and ensure that they do not cause physical side effects or psychic disturbances. People should recognize that medicine does not cure disease, rather, nature cures illness with the help of the body's healing power. Medication only helps to accelerate the activity and speed of the healing process. Diagnosis is critical. It is a fact that most of those who die while under the care of doctors die due to incorrect diagnoses and wrong prescriptions. We can equally fault all medical systems for wrong diagnoses, but as far as wrong medications leading to death, more blame should fall on those who use heavy doses of medicine, such as allopathy. Patient's welfare. The patient's welfare should be the main aim of the medical profession, regardless of the philosophical or logical ramifications of a particular system of medicine. Doctor's chamber to polypathy hospitals. Doctors may find it somewhat challenging to work with such a principle because it is unreasonable to expect them to be experts in all the medical systems. In reality, it is improbable. Nevertheless, what is not possible in a doctor's chambers would be possible in a polypathy hospital. Polypathy Board of Doctors. In polypathy hospitals, the patient's welfare is prioritized, and the patient is treated accordingly. Immediately after being admitted, they are thoroughly examined by an appropriate board of doctors who determine the most suitable medical treatment system. For example, if allopathy can quickly cure a patient's disease, they will be treated by an allopath; if by homeopathy, by a homeopath; if by naturopathy, by a naturopath, and so on. If various types of treatment are available under one roof, changing from one type to another will not be difficult if the patient does not respond to a particular treatment method. Medical treatment can be roughly divided into three groups. First group, treatment by disease indications. The predominant first group systems are Allopathy, Ayurveda, and Hakimi, based on the disease symptoms and prescription of strong medicines. Although diagnosis and remedial methods differ, the selection of medicines involves significant risk because more emphasis is placed on the indications of the disease than on those of the patient, and the possibility of causing death. The danger in diagnosing illnesses and prescribing medicines according to the germs and diseases present in the body is that it is nearly impossible to arrive at a firm conclusion about the precise nature of germs. Moreover, whether the conditions are caused by germs or those are created from illnesses caused by other factors remains controversial. The symptoms of one disease may be identical to those of another, and the remedy for one may prove to be completely ineffective or even harmful in the case of the other. Moreover, as poisons are used, they may seriously affect the patient's vitality. Treatment by patient's symptoms. The second group's principles, application and philosophy of homeopathy and others are entirely different, treating the patient's symptoms, not the disease or its indications. So there is minimal possibility of causing harm, even if the diagnosis is not entirely correct. A doctor with good powers of observation and a subtle sense of discrimination can easily prescribe remedies according to the patient's symptoms. Further, homeopathy medicines are administered in subtle doses, not in powerful tablets. Nevertheless, such doses quickly become active in the molecules of the patient's body and their mental sphere. The difficulty with homeopathy is that it is based upon the subtle intellect of the doctor, Sustained effort is essential to achieve such a degree of subtlety. Surgery and injections are not acceptable to homeopathic philosophy, but we cannot deny the need for surgery and injections in certain instances. Nowadays, of course, surgery is gradually being incorporated into homeopathy. It is a positive development. Third group: treatment by gifts of nature and yoga. The third group of naturopaths do not believe in using the medicine. They think that it is possible to cure patients through the gifts of nature only, through the earth, water, light, heat and air, together with a proper diet. It is possible. The healing power of nature cures disease, medicine only helps nature. But it is also often difficult to wholly and gradually attune the body to nature. The mind of the patient helps to activate the healing power of nature. Just as we can restore diseased body organs to normal by administering medicines internally or externally, one can also heal them, more safely and more perfectly, with the help of Yaogika Ásanas and Mudrás. If a doctor, in whom the patient has complete faith, prescribes water instead of medicine, it will cure the patient. Still, if the patient regards the doctor as a quack, the disease will not be cured, even if the purest medicines known to medical science are prescribed and properly administered. It is evident then that the power of the mind fixes the disease, the medicine being secondary. Physical and mental medicines. A disease can be mental or can be physical. Similarly, the medicine may be psychological or physical, hence, it is most desirable and productive if both medical treatments are administered simultaneously in all physical or mental diseases. Patient's faith in medical personnel. The patient's faith is more important than medicine in curing a disease. It comes from the conduct of the doctors and nurses, who have to win their confidence and inspire them with faith. Doctors must use all the qualities of their minds to win over their patients. Beyond senility and death. We know too that medical science has helped people immensely in the past, continues to help them in the present, and will similarly help them in the future. For a long time, developed medicine and surgery have been helping people increase their longevity. If people could give senility and death the slip by replacing old glands with new ones, what else could they want? Humanity is now capable of doing this through medical science. One of the reasons the physical body dies is because its glands become old and weak. So one can postpone death if a person's glands are replaced.